Good morning, my dear brothers. Welcome to our Biomedical Ethics class. The last class we dealt with abortion, also the view of the church, and we saw two clips. What does the church, Vatican, or the Pope say about the abortion, and we concluded saying what we call killing an innocent baby, an unborn baby, is always morally unethical, morally evil. No? That is where we completed our last class, the view of the church on abortion. Today we shall begin with our new topic, euthanasia. No? Euthanasia. What do you see in the picture?
Vaccines.
It's a book or a code, what that which says about what is euthanasia. Also, now to what we call terminate the life, through medicine, through the injection. Through the injection, we usually terminate a living person who wanted to die, who wanted to end his life. The picture says the injection and medicine is ready to be inserted into the veins of the patient, who desires for euthanasia, who want to end up his life. Now, before we begin, I have three questions like this for us personal to reflect on. Also, we shall deal with these three questions or answer to these three questions in our topic euthanasia. Now, the first question: is it wrong to put to death a person in great pain who has no hope of recovering? Is it wrong to do a mercy killing or to do euthanasia a person who has no hope of recovery? Or imagine a person who is at the final stage of cancer. It is impossible to cure him or to recover him, to bring him back to normal health, normal life, because he is in the final stage of his life. There is hardly even 1% of possibility to bring back. The case he has absolutely no hope because the cancer has advanced and it is on the final stage. Doctors have given the patient hardly few days, could be 1 week or 2 or 3 days. Imagine if that is the situation, can we allow euthanasia in order to to relieve him from his pain, to relieve her in her sufferings, whatever may be. So is it morally wrong or right to give that particular patient an injection, a medicine, so that he could escape from his pain and sufferings and attain the death the patient is desiring? Okay, this is a question. We shall see the answers, how the church defines life and how the church promotes and protects life, and what does the church say also with regard to euthanasia. And second question: how can we know when to stop medical treatment near the end of someone's life? Imagine you are giving medicine, the treatment is going on. At the same time, there is no hope, there is no sign, symptoms of recovery. Now, when to stop? The day you stop, tell the hospital, the doctor, please stop giving the treatment, they will stop. They will stop. I'm sure once you stop the medicine, the patient is not going to survive. Be it 1 day, be it 2 days, that which he is supposed to survive with the medication 2 days more or 3 days more, but you are going to stop him on the same day that you are going to confirm with the hospital, with the physician saying, please stop the medication. They are going to stop. They are going to stop the medicine and all the procedure. The next moment, the patient is going to die. So, how can we know when to stop? When to stop the medical treatment? Third question we have: should the law allow doctors to perform euthanasia when a patient requests it? So, when I ask for euthanasia directly to the doctor, can the doctor, physician, by law, by the law of the state, can he perform the act of euthanasia on the patient? These are the three basic questions that we are going to learn. Also for you also to reflect. What would be the criteria or the moral point of view, how they are going to be, as far as also to learn and to reflect. Okay, good. Now, what is euthanasia? The word euthanasia is derived from the Greek words. Okay, first is eu, eu, which means good. Okay, eu means good. There are thanatos. Then thanatos, which would mean death. Eu, which is good, and thanatos, which would would say death. And therefore, we the people sometimes understand it to mean good death. When we combine good and death put together, we understand euthanasia is good death. That's what we understand by the terms. Or rather, a misleading understanding of the term. Sometimes it misleads the concept of euthanasia or good death. Let us see. Sometimes this procedure is popularly called as mercy killing. Sometimes people use, shall do the mercy killing or compassionate killing. Mercy killing or compassionate killing. And another term that is misleading. When you say mercy killing or compassionate, we are thinking or imagining that we shall do justice to the patient because he is sick or the patient wants to die. So shall be compassionate. We shall be merciful upon the patient, and whatever he desires, the patient at the last moment, we shall execute it. We shall carry it. We shall carry forward in fulfilling the desire and the want of the patient who seeks the mercy killing. So this is also another term is misleading actually. Though by term origin we say good death, mercy killing, and compassion killing, but it is not proper. It's not proper. We shall learn. So sometimes some people call it mercy killing or compassionate killing. Is another term that is misleading in portraying such an action in a positive way. And they think that by mercy killing, by compassion way of giving death, they are doing justice, and it is a positive way of what you call ending one's life. That's what people think. Euthanasia is simply the act of intentionally ending the life of the person who is elderly, terminally ill, or suffering from some incurable injury or disease. Actually, euthanasia would mean or would say an act which is done with full your knowledge and will to end the life of a person, to finish a life of a person, especially who are elderly, who are struggling for their life, struggling for their health in the hospitals, getting treatment, but they are not recovering because of the advance of their health conditions, because of due to their elderly age, etc. And they are all terminally ill. Permanently, they are ill, cannot be easily recovered. There is no possibility, less chance or less possibility. Okay, so any act done intentionally to end someone's life, especially elders who are in the hospital due to their age or due to their sickness, which is terminally ill, which is permanent, cannot be taken away or cannot be cured that easily, or suffering from incurable, incurable, that cannot be easily cured, that cannot be easily healed. So incurable injury or disease. Okay, that's what it means. Let us see the definition. By euthanasia is understood an action or an omission which of itself or by intention causes death. An action or an omission. Understand the term omission, that which you are supposed to do, we are not. Which itself by intention causes death. In order that all suffering may in this way be eliminated. You think that doing this, all the sufferings may be eliminated. all the sufferings may come to an end. Okay? So Euthanasia's terms of reference therefore are to be found in the intention of the will and the methods used. Always it is referred to the intention of the one who performs and the methods that are involved in the what you call in the act of euthanasia. Okay? Now we shall see two video clips that will enlighten us, that will guide and that will help us to understand the term euthanasia and how it is practiced. Over here in India, we shall say in India there are two elderly couple. They are seeking for euthanasia. They filled an application to the President of India last year, asking permission for euthanasia. We shall see their case, as well as there is another clip, another video also that will give us more light and that will help us to understand the term euthanasia and how it is performed. Now we shall see those two clips.
We are lived sufficiently well and there is no further purpose in continuing to live. So instead of living further and creating trouble for others, it is better to live early. That is why I have written to the President to exercise his power under the Constitution to grant mercy. He grants mercy to the people who are convicted for heinous offences by death penalty. So instead of exercising that power to kill people, he should kill us by exercising power, because the right to live also includes the right to die.
Nobody will come, I am sure. Because you will see that in every city, the people have no time. I was a teacher in high school. What's the use of sitting here only and to see TV or on the phone or read the newspapers? What's the use of my life now?
If there is no response, I will have to give an advertisement in the paper asking the underworld Don Arun Gaudhia, his associate, to come forward and kill us. So we will give them 5 lakh rupees each. But this course of action is not proper, because it will entail different effects. There is nothing to be afraid of. They are only to give me potassium cyanide. If I try to acquire that potassium cyanide, I may not get proper quality and it may be adulterated. So instead of giving me this, they will give that consumption of potassium cyanide in adulterated form, which only worsen my situation, which I do not want.
Se produit dans la veine du patient. Et en moins d'une minute, il s'endort et puis il décède. Sans aucune souffrance.
Nous allons tous mourir. Et je le crois, moi, d'exiger une qualité pour la famille.
Vous êtes au dernier soir de votre vie.
Tout à fait. C'est réglé le matin.
Vous attendez donc le papa, la part de descendait, une euthanasie dans un avenir assez rapproché. Qu'est-ce qui va vous faire décider d'une date que vous allez nous proposer?
Moi, je pense que c'est une communication et mobilité des citoyens.
Accepter qu'on ne peut pas tout guérir et notre rôle quand on ne peut pas tout guérir est d'essayer de soulager le patient, d'apaiser ses souffrances. Je continue à remplir mon métier de médecin en allant jusqu'au bout du bout. C'est vous qui décidez, qui est là, qui n'est pas là, et c'est vrai que oui, non, c'est une chambre d'hôpital. La moitié de ici, bon, il y a toujours une ou deux personnes de la famille qui sont là. Mais c'est vous qui décidez tout ça. C'est la première fois que je vois quelqu'un qui vient ici à mon bureau en anglais. Il n'aurait pas pu utiliser d'autres moyens de transport, c'était impossible. Il remplit les conditions nécessaires, il a fait une demande écrite. J'ai le document, donc il a cette maladie qui est grave et incurable, et il a des souffrances, il a raison. Il remplit les 3 conditions de base. C'est un geste important, difficile, qui a un impact émotionnel grand. Je n'appelle pas ça tuer un patient, je raccourcis son agonie, je raccourcis ses souffrances, je donne le dernier soin, mais je n'ai pas l'impression de tuer le patient. Vous ne souhaitez pas mourir pour le moment.
On est censé faire des choses, je comprends bien, mais je pense que c'est tout. Je considère que la mort, ça se regarde en face, et si on peut, on l'attend de vue. C'est un sujet que je dois parler plus, parce que nous allons tous mourir, et j'ai le droit, moi, d'exiger une qualité de ma folie. Donc, je ne veux pas finir dans un déchoir. Je suis une patiente de l'ordre pour envisager une solution qui serait plus humaine et plus efficace.
Personne qui nous a quittés, qui m'a parlé, qui a son logiciel avec ses yeux. Elle fixait une lettre et il est parvenu à faire cette phrase. Merci de me soulager, je suis fatigué. J'ai été très impressionné. Elle était atteinte de la maladie de Charcot. C'est difficile de refuser. On est obligé, vu le nombre de demandes, de choisir. Donc je prends toujours les patients les plus gravement atteints. Ça m'est arrivé de dire non, pas pour des raisons uniquement médicales, pour des raisons affectives, ou des gens que je connais très bien, des personnes de ma famille, hors de question de placement. Je viendrai vous dire bonjour, voir si vous n'avez pas changé d'air. Comment la nuit? Et le professeur viendra vous dire bonjour, et puis on ira préparer les produits qui vont vous en. Voilà, c'est ça. Vous pouvez.
Vous ne pouvez pas imaginer le souvenir de l'immobilier qui a possibilité à pousser de savoir ce que c'est. Ça m'a fait un point, mais j'avais sur la poitrine, c'est imaginable. J'étais même transformé et envoyé en plein de l'issue.
At the very beginning, he told me I will struggle up to the end. I will do all my best to be cured. But actually, all the very heavy treatments didn't work. So now he's given up.
Mais notable. Je vois ma femme freiner un petit peu peut-être que vous allez longtemps. Puis j'arrive pas trop me cahier une nuit. Je vais à Payalas. Surtout une semaine. Je peux te dire non. Nous avons
It was difficult for me to accept it. And I say, the longer time we are going to wait, the better. But such is life, Time has come for him to stop his life, because his life is not his life anymore. He has been too fed for nearly 1 year now. So he said, I'm like a dog, I feel like a dog with a leash. It's a bit inhuman.
Là, vous êtes au dernier soir de votre vie.
tout à fait. C'est avec les mains. Mais non, il va. J'ai du mal à y aller, mais au moins Isabelle était pas bête. Je n'avais pas d'accident, comme ça, et là, on en prépare. C'est pas tout, c'est relativement actif.
Voilà, Michel est parti avec beaucoup d'émotions, mais ça s'est très bien passé. On n'a pas dormi une nuit de toute la nuit, ça a été très long. Il nous a dit merci encore en partant. Les larmes de son épouse et de ses deux fils, c'est une image qui me reste pendant quelques jours. J'ai un peu le contre-coup.
They have no sons, they have no children to take care, And the old lady, what was her profession? Teacher. She was a teacher. She learned so much about education, teaching, sharing and imparting a lot of her wisdom, knowledge to the young students when she was a teacher, in 60s or 70s. But now the teacher who knows the things, who understands the things better than other people, uneducated, when she herself comes forward and she says, there is no use in just watching TV, making phone calls and reading newspapers, sitting idle at home. We have no hope because we have no children, nobody is there to take care of us. We want to end up our life. So the man says, if the president doesn't give us a permission, what he says, another method. He says, you will hire dons to come and finish them by paying how much? 5 lakh rupees. You want to pay to the don, to the gundas, so that they will come and kill them. Will come and kill them. Again he says, even this also doesn't work, I shall go and get the medicine. He says the medicine, particular medicine chemical that which is available in the medical shop, I can at least do it by myself, but then it won't be that successful. I won't get that effective because they may understand that I am going to do such an act. They may reduce the capacity, they may reduce the power in that medicine, so it may worsen my life, or it may pull my life, but with the sufferings and pain, but I will not get that. That is another worry. First thing is, he is trying to apply to the president the permission. Second, he want to hire don, gundas, to finish. Third option he says is, you will get medicine by himself from the medical, and he will terminate. That has got less possibility because they may understand and they may not give proper, or that may worsen his life. So he may fall into the more pain and sufferings, but again life may be pulling on. So he is not so much pathetic, and he says he has no hope, doesn't want to leave his life. They both look healthy, They both. She was cooking, She was cooking actually, and he was walking in the veranda on the top of his house. They were not bedridden or imagine if you are bedridden and severe sickness like cancer or tumor, etc., okay. They both are well to do. Well to do in the sense, healthy. They can walk, they can read, they can see, no? They have no eyesight and all, okay. Or somebody is physically disabled, the wife has to take care of the husband, or the wife is disabled, the husband has to take care of the bathroom, give bath, etc., that really it is painful. But both, they are able to walk, they are able to communicate, they are able to see, no? They are able to enjoy their life, but still, they are seeking for euthanasia. This is one of the cases, I don't know where it was in Mumbai, I don't know, you see the location, they gave the location. I don't know if you saw, notice the location where it was. That is about the first video, no? They are seeking for an euthanasia. The second video, did you understand, though it was it was in French and other local language of Belgium, but the subtitles were in English. I don't know if you could follow. Who was the doctor? Doctor's name? Michael. No. Dr. De Luchot. We began first to know that doctor name is De Luchot.
Nous injectons dans la veine du patient. Et en moins d'une minute, il s'endort et puis il descend. Sans aucune souffrance. Il s'endort.
Nous allons tous mourir.
Okay. So the doctor name is De Luchot. No, he is from Belgium. So he practices. No, he practices medicine and he helps people. No, those who are elderly, those who ask for euthanasia. According to the report that we read, he performed more than 2,300 deaths. Euthanasia. If patients came to him and he helped them. So in Belgium, it is legal. Okay, euthanasia is legal. So a patient from France traveled about 700 kilometers. You have seen in the video. He traveled 700 kilometers to ask the help of this particular Dr. De Luchot, to perform what you call euthanasia upon him. Okay, but in UK, United Kingdom, it is forbidden. The doctor was in UK, would have been now arrested. He is in another country. He says, I will help people, in their agony, in their sufferings. Because for all the diseases, sicknesses, we don't have medicine. We have medicine but doesn't help for all the advanced cancer, for example, advanced tumor, or any sickness that is in your body. It has come to the advanced stage. There is no hope, there is no medicine. So in that situation, he says, I am really helping my clients, my people who come to me seeking for euthanasia. So actually I help them to relieve, to come out of their pain, to come out of their worries, to come out of their sufferings and the emotional tensions and what we call the physical agony that they are undergoing. That is what the doctor says. Because we don't have the proper medicine for all the sicknesses. Okay. Again, you might have seen in the video, an 82-year-old police officer, he was a police officer, retired man, he is being affected with a jaw cancer, It's cancer, maybe extra growth here on the jaw, So there is no treatment, there is no medicine to cure this cancer. And the wife says, sometimes it is pretty inhuman. She compares with the dog. She compares with the dog, but it is inhuman, but anyway, he deserves his dignity, to have his the death that he wishes. Who says? The wife of the 82 years police officer. She says the time has come for him to stop his life. The time has come for him to stop his life. Again, the doctor, he makes sure he visits the patients, the people who ask for euthanasia, the last night of their what you call death. Suppose they have made an appointment for euthanasia for tomorrow. So doctor visits today evening. He goes and meets, visits the family, talks to the family, people, his wife, etc., and is very kind. He's not very harsh and seeking money. That is there, but then he's very kind. How he respects the doctor, respects the patient, listens to them. What is your suffering? What is the problem? How do you want to end up your life? during the euthanasia, you want to bring the whole family. No, you want to bring at least one or two. You want to show them how you are going to die. No, it's really painful, but that is how things are taking place. No, in our world today, there are countries which says no. There are countries which says yes. We shall be in coming classes. We shall see how many countries of around our world that says yes, that gives permission to euthanasia. I think in India it is yes, but not full. In a way, some positive euthanasia. There are criteria, principles to be followed in India. It says yes, but not with the full intention, but there are criteria to be followed. So in India, it is permissible to do the euthanasia, but there are criteria, some moral principles and laws to be followed. Okay? So, now the euthanasia, this issue often comes to focus in the case of terminally ill patients who are experiencing long-lasting or permanent pain and therefore no longer want to live and may even wish to put to death. It is also a question in the case of people who have lost much or most of their mental capacities because of coma or severe other sicknesses, or patients who appear to have no reasonable human hope of recovering from a severe injury or illness. Now, what is morally right thing to do in such cases? People who are elderly, who are terminally ill, the sickness cannot be cured. They are asking their death. So, what is morally right to do such thing? Is it right or wrong? Okay. Now, there is a difference. The difference is the crucial difference between killing and letting die. There are two possibilities, two ways in euthanasia. Now, a clear distinction must be made between killing and letting someone to die. Killing is actively doing something to a patient that hastens or rushes or speeds up or causes his death or her death. Understand? Killing is something doing actively with full intention to the patient, that which speeds up, the time of his death, immediate death. On the other hand, letting die is passively allowing someone to die from other causes without interfering with that process. So in the first case, the cause of death is the action taken by another person, that is a killing, is direct. The second case, which is letting to die, the cause of death is the disease, the injury, or the age that has already been occurring in the person who dies. You understand? First is a direct killing with intention because the person has asked, you are performing. So it's a direct. Okay? The second one, letting to die. The person already suffering from cancer, other sicknesses. So even if you give treatment, sure that he is going to die. And if you give treatment, sure that he is going to die. So you are just stopping the treatment or the basic things that we are supposed to provide at the point of death. You know that he is going to die, but doesn't mean you have to stop. People, he is going to die. Why to spend so much money? Why to spend so much money in operation? Doctors, they have said that you can operate, but then the result will be negative. You cannot save him. So in that case, they say, okay, let him die then. So they are letting him to die by stopping the medication, by stopping the treatment, by stopping the basic requirements that we are supposed to do. So you understand the term? Killing and letting someone to die. Okay, these two are taking place in euthanasia. Okay, I shall repeat once again. A clear distinction must be made between killing and letting someone to die. Killing, first is actively doing something to a patient, that rushes, or that speeds up the cause of his death. Understand? You are directly. On the other hand, letting die is passively allowing someone to die from their causes, without interfering with their process. The first case, the cause of death is an action taken by the individual. The second case, the cause of death is due to the disease, not by the individual. It's already is being affected, with the cancer or such a grave sickness that cannot be cured. When you do treatment, he is not going to survive. So that is what you call difference, what you call between killing and letting to die because of not having enough money to pay in the hospital. So anyway, he is going to die. He cannot save him. Even if he pay, even the doctors perform the surgery, they are not going to save because he's already at the last stage, at the final point. Okay, understand the term killing and letting die. While the Bible prohibits actively killing someone, in the case of letting someone die, the moral decision is more complicated, a bit complex, not clear. Sometimes it is clearly wrong to let a person die. We should intervene and try to help a person recover. Christian understanding, we have to try to save. We know that he is going to die, but we don't just give up. I know there is no hope. So it doesn't mean as a Christian I can just see him that he is dying without receiving his basic treatment that we are supposed to give. I'm sure that he is going to die, but I cannot stop. My Christian values, my teaching would say to do whatever you can. Do the treatment, do the medication, let him survive. It could be hours, it could be few minutes, no problem. But let him die of his natural or But not that you already decided, okay, anyway he is not going to survive. Let me switch off the ventilator, let me switch off the machines that are connected with the body so that he can die fastly. That should not be our Christian way. So while the Bible prohibits actively killing someone, in the case of letting someone die, the moral decision is more complex. Sometimes it is clearly wrong to let a person to die. That is the direct. We should intervene and try to help a person recover, and not passively allow the person to die. When there is a reasonable human hope of recovery, and we are able to, when we think that there is some chance of possibility, some chance of recovery, we shall not give up. Or when we are able to help, suppose I am financially poor, I am not able to help, that is a different case. But when I have money, when I can, I shall not think that even if I pay money, he is not going to survive, so I shall withdraw the money, I shall withdraw the operation. Say to the doctors, no need, forget about the operation, please don't perform, please don't do the operation so that he dies soon. No. So when you can pay money, when you are afford to do, please do it. That is what Christian teaching would say. This would be obeying Jesus' teaching. You shall love your neighbor as yourself. And his command, so whatever you wish that others would do to you, do also to them. You always want and wish that the person should do to me, this, that, should have been better. So whatever you wish, you desire that other people want to do to you, same thing you also must do to the others. This is what we call a teaching of our Bible, of Jesus. So whatever you wish that others would do to you, do also to them. For this is the law and the prophets. Matthew 7, verse 12. Moreover, in the parable of a good Samaritan, Jesus implicitly condemned the priest and the Levite who neglected to do what they could help a badly injured man. The parable. The Levite and priest, both of them traveled. They saw the man was lying half dead, half naked. The Lord is dragged him to the hospital, or at least put some cloth and stop the blood, or some basic, first aid. Say in our language, first aid. Actually, if you see someone is there is an accident or died from the chin, fell from the bike or cycle, immediately we rush. We do the first aid, the basic thing. So in the case of the Levite and the priest, they just saw and they proceeded. They never minded the poor man who was badly robed, badly beaten up, badly off dead. He was almost dead. So it was the duty or the obligation of the priest and Levite to take care of him, to do the basic, but they neglected and they proceeded. On the other hand, in cases where there is no reasonable human hope of recovery, sometimes called a situation of futility, situation of futility. That is of the fact that having no effect or achieved nothing, not able to do, not able to help. So it is the patient's wish to be allowed to die, or we are unable to help, such as when a person is trapped in a burning car. For example, you see, as you are traveling by highway, immediately a car gets fired and it's burning. And you have all that you have is one bottle of water in your car. So with that one bottle, are you going to extinguish the fire? No. In this case, you are not able to help a man who is sitting in the burning car. You may have tried to pull the door, but then he's already inside, not able to pull the seatbelt. It's already hang up inside. All that you have is one bottle of water. That water, by the time you call a fire station, by the time they come, things will be brought into ashes. So in this case, what you are going to do? You are helpless. We are helpless. Seeing in front of your eyes a burning car with 2-3 passengers. Or when the expense of necessary medical treatments is more than we can bear. Imagine the poor families, when they want to treatment, they are asking lakhs and lakhs. They have already, they have the daily coolie workers. 200 or 300 per day. If that, can imagine what treatment in the high-fi, what you call hospitals, where they demand lakhs of rupees. Lakhs of rupees. So in the case sure that you say, I have no money, sure the person is going to die because he has not paid the money in the hospital. So they are not going to perform any operation or they are not going to perform any treatment. This is morally distinct from actively murdering a person. In this case, it will be different. As I said, you see a burning car where there are patients, so people are there not able to help. Not able to help. It is not a direct killing or indirect or getting to die, but you are helpless. All that you have is one bottle of water, you try to pour, but nothing takes place. By the time you call what you call the fire service, fire station, by the time they come, things are over here. You are helpless. We are helpless in this situation. So allowing someone to die may include not starting a medical life support system. We're supposed to do it. That he is going to die, but we're supposed to give the basic requirements of the patient. Like the ventilator, the oxygen, the mask that is supposed to wear, in the hospital with the treatment. That if you neglect, he is going to die immediately. Recently, Pope Francis, he donated 20 or 25 ventilators in the time of Corona to Europe, also to country Malawi, what we call he donated artificial respirator and other what we call ventilators, ultrasound scanners. He donated to other poor countries so that they could get a basic and proper treatment, because they are poor and they are not able to afford it. So Pope, he donated at least 20-25 ventilators and ultrasound scanners to poor countries and some countries where the Catholic institutions are running this hospital. I think in Malawi, the Episcopal Conference of Malawi country, they are having their own hospital. We have Episcopal Conference of India, they have the Episcopal Conference of Malawi country, they are having their own hospital. They were lacking ventilators and the basic what you call ultrasound scanners. Pope Francis, when he heard, immediately he sponsored, donated these equipments for the patients. Okay, hospital. It's very costly. Missions are very costly. But seeing them, their condition, immediately Pope Francis came forward and he donated all the food.